With rising cases of monkeypox in the country, the Union Health Ministry today released a list of do's and don'ts to avoid contracting the disease. It also underlined that anyone can catch the virus if they have had prolonged or repeated contact with an infected individual. Among the do's, the ministry advised isolating the infected person from others so that the disease does not spread. Use of hand sanitizers or washing hands with soap and water, covering mouth with masks and hands with disposable gloves when close to a patient, and using disinfectants to sanitize the environment around. The don'ts state avoid sharing linen, beddings, clothes, towels, among others with people who have tested positive for the infection. The ministry advised not to wash soiled linen or laundry of patients and those of non-infected persons together, and avoid public events even if you only exhibit symptoms of the disease. Do not stigmatize people who have contracted the virus and suspected patients as well. Also, do not believe any rumor or misinformation, it said. Meanwhile, a task force on monkeypox has been constituted to closely monitor the emerging situation in the country and decide on response initiatives to tackle the spread of the disease. The World Health Organization had recently declared monkeypox a global public health emergency of international concern. Monkeypox typically manifests itself with fever, rash, and swollen lymph nodes and may lead to a range of medical complications. It is usually a self-limited disease with symptoms lasting for 2 to 4 weeks. It can also be transmitted through direct contact with body fluids or lesions and indirect contact with lesion materials such as through contaminated clothing or linen of an infected person. Animal to human transmission may occur by bite or scratch of infected animals or through bushmeat preparation. The incubation period is usually from 6 to 13 days, and the case fatality rate of monkeypox has historically ranged up to 11% in the general population and higher among children. In recent times, the case fatality rate has been around 3 to 6%. The symptoms include lesions, which usually begins with 1 to 3 days from the onset of fever, lasting for around 2 to 4 weeks, and are often described as painful until the healing phase when they become itchy. A notable predilection for palm and soles is characteristics of monkeypox, the guidelines stated.